G'day everyone, welcome to this little demo of the Epic Virtual ED app. So a little shout out to my two colleagues, Thomas and Luca. So this is me, Zaf. I've created most of the content. Thomas is our 6th year med student who did all the coding, and Luca is our 4th year medical student who's been very helpful in the creative and patient journey aspect of this project. So Epic Virtual ED is Emergency Physicians Important Cases Virtual ED. It's a high-quality, interactive, web-based digital medical education platform that simulates an emergency department to enhance the learning experience of medical students. So this is the student journey. During the app, we start in the fishbowl, and that's where we interact with the ED consultant, your supervisor, and talk about patients. Then you go on to see the patients themselves. So that's at the patient bedside. And the third part is the library. So as part of the app, you go into the library, read up around the cases, look at digital resources and lecture slides. Okay, let's have a look at Epic Virtual ED. So this is the front page of the ED. It starts with a shift mode. There's MSAT practice, question tab, performance, and library, along with the learning outcomes. So let's start at shift mode. These are the 12 symptoms that each shift is based on. So let's say we're going to do the shift that focuses on patients with abdominal pain. So you click that button. You can do more than one if you like. Let's just say we're going to do abdo pain. We want to do the cases that we haven't tried before. Now, there's two different modes. There's the teaching mode, which when you do the app, it includes all the lecture material embedded within the shifts, and it's best for first-time learners and for relearning material. And then you can also do a practice mode, and that's where you don't have any lectures and you're going straight to the patient bedside for an uninterrupted experience. And this is better for like practice and revision before exams. Let's do the teaching mode. Okay, let's start the shift. And here we are. This is the ED, the virtual ED. Forgive the graphics, it's just the beta version. And in the middle here is the fishbowl. So in the fishbowl, this is when you talk to your supervisor and get feedback. And so you start here. The first thing you do is you click the handover. So every ED shift starts with a handover. When you click this button, you're greeted by me, and this is what we say.
Hey guys, welcome to your shift. I'm Dr. Zaf. I'm one of the ED consultants here, and I'll be helping supervise you today. So here we are at the fishbowl, and we've got quite a few patients that I think you'd really enjoy chatting to. And these patients for your shift I'd like you to see all have abdominal pain. So what we'd like you to do is pop in, have a chat, listen to the patient's history.
Okay, so you get the idea. So that's a little handover, kind of a 1-minute welcome to your shift. Then at this point, the students can choose whether they go straight to start seeing patients in these different rooms, bed 4, bed 3, or if it's their first shift and they're a bit nervous and they're not quite sure about abdominal pain, they can go to this little pep talk series. Now, when you click on this, these are the 9 key abdominal pain cases that I want the students to know about. And so they can go in any order and choose to watch these little videos about these topics. So let's say pep talk. Let's look at the introduction.
G'day team, and welcome to this little pep talk on abdominal pain. So in this little session, we're going to cover some of the key pain pathways, visceral, parietal, and referred pain, and look at the pathophysiology of 9 critical conditions that cause abdominal pain.
Okay, so you get the idea there. And so with that gives them kind of the basic sciences, the pathophysiology, anatomy, pharmacology, that will help them understand the cases when they see them. Now, at this point, the debrief button will be blanked out, so they can't click on that until they start to see patients. So let's go to the first room. Okay, bedroom 1, cubicle 1, 62-year-old female with left-sided abdominal pain and nausea and vomiting for 3 days. So when you click on this is the basic template for every room. You come in, you see the picture of the patient, and on the left here, there's this 4 headings: history, exam, investigations, and management. These 4 are the bedrock headings for every patient. So let's start. Look, you can actually jump around. So why don't we go to investigations first? You want to have a look at the x-ray, and there you have it, and you might be able to guess the diagnosis just from that abdominal x-ray. Otherwise, you can go to exam, you can click on the vital signs, you can look at a specific abdominal focused exam, a general inspection. But let's go to history. Now, when you click on the history, there's 3 ways you can interact with this patient looking at history. You can just click the notes, and that's just the written text of what they've presented with. If you want to be more interactive, you can go to the AI consult, and that clicks on an AI bot function so you to interact and talk to the patient. Otherwise, we can just watch the video of this patient, Olive.
Doctor, please help me. I've had left abdominal pain for the past 3 days. I'm in so much pain. It normally lasts for 30 seconds, but now it's lasting for 30 minutes.
And I have not gone to the toilet in a day.
Yeah, okay. Probably still need a bit of modification there on those videos, but you get the idea. And now this patient is actually a student. So that's a really important part of the app, is the role players are actually students themselves, third-year students. And that adds a bit of buy-in. So, everyone wants to see themselves or see their mates acting. And so that increases engagement. So once you've seen the history there, you'll come down to question 1. Now, it won't allow you to progress to the end of the case until you've done the questions. The question is, question 1, identify the key features on history. So what was the key thing? She said she had abdominal pain, nausea, vomiting. You type in the text and you go check. Then you're given a model answer. Abdominal pain, nausea, vomiting, constipation. And this was what you've written on the left, your answer and model answer, and you self-mark. So let's say you got 3 of those, you get 1.5 marks. Go into question 2, what's the 4 most likely differential diagnoses? Again, a free text box, type it away, and away you go. You've put in small bowel, large bowel obstruction, gastroappendicitis, and those were the key possibilities, except renal colic was one that was missed. So then you self-mark yourself, and you've gotten 0.5 or 2.5s wrong, so you've only gotten half of the marks available. So you do that, go to exams. Examination, again, you've looked at the vitals, the abdominal exam, they've got left lower quadrant with a palpable 5 centimeter mass in the groin. What could that be? Well, you put in your question 3, differential diagnoses, ischemic bowel, renal colic. What are the presenting features and absent features in this case? Again, free text box, type a few answers there, and you get a model answer for this question. And then you mark yourself. Let's say you've gotten 0.5 out of all of those correct, and you get 2 marks. Go to investigations. Then you have this, it could be one of 3 things, an ECG, a blood gas, or in this case, an X-ray. And again, free text, write what you think it is and describe your diagnosis. And you get given the answers: dilated loops of bowel with plicae circularis. This is a small bowel obstruction. So give yourself the marks, tally that there. And management. Again, question 5, the CT scan shows a bowel obstruction. What is your management of bowel obstruction from a strangulated hernia? Free text, again, surgery, analgesia. Did you get the answer right? You mark yourself. All those points go to a leaderboard. So now we've come to the end of this case. You can click on to go back to the debrief. So we go back to the fishbowl. And at this point, you can go to the debrief button. And we've just met Olive. And when you click on the debrief computer in the fishbowl, this is what you come up with. So you get a little short video.
Okay, a bit of a debrief now on Olive. She's 62 and she's got left lower abdominal pain radiating through to the groin. So if it's left lower abdo, it could be renal colic. It was coming and going, but now it's constant. Now the key thing with her is she's been vomiting. So when you look at her in front of you, she's actively vomiting, spewing her guts out. And when you examine her groin, she's got this palpable mass, 5 centimeter mass.
Anyway, so this video, the key with this is, as a clinician, I'm sharing with the student the diagnostic reasoning behind those different clinical signs, the history, exam, and putting it all together into why it's a bowel obstruction and not a different diagnosis. So after that, that's one patient down, and the students can wander around. Let's go to, say, bedroom 4. Now, this is where it gets interesting. You can keep going in that sequence, or you could use the AI function. So let's say we go into bed 4 and we decide we want to use the AI bot to look at this patient. So I'm just going to show you the AI function. Give me one moment. Just going to screen share, coming on there. All right, so this is the AI bot. This was created by Thomas. So let us start. This is Daniel Green in bed for 67-year-old. Oh, g'day, Daniel. It's Dr. Zaf here. Can you tell me what's brought you in today? Stop talking. Okay.
David, I've been feeling a sharp pain in my abdomen that just won't go away. It's been getting worse over the past few days, and I also feel really lightheaded and weak. I knew something wasn't right, so I thought it'd be best to come in and get it checked out.
Okay, so Dan, you said you're feeling lightheaded and weak. Did you actually black out with this?
Yeah, mate, I did actually black out a couple of times. It was pretty scary, feeling all woozy and then everything went dark. I'm just glad I made it here to the hospital in time.
Okay, and Daniel, does the pain move anywhere? Like, does it go through to the back? Does it radiate to the groin? And also, have you had any fevers? See what he
Yeah,
says.
the pain does radiate to my back, and it's like a sharp, tearing sensation. It's quite intense. And no, I haven't had any fevers that I've noticed. Just this horrible pain and feeling really out of sorts.
Okay, now because it's AI, you can actually ask random questions and it'll give you a bit of an answer. So how about this? G'day, Daniel. What kind of hamburgers do you like to eat from McDonald's?
I'm actually not in the mood to talk about hamburgers right now, mate. My stomach is in a lot of pain, and I'm feeling really unwell. Can we focus on figuring out what's going on with me?
Yep. Okay. Sorry. Sure, Daniel. We'll focus back on your abdominal pain. I just got to go to the bathroom. I'll come back in a moment. Bye. See what he says there.
No worries, take your time. I'll be here when you get back. Thanks for looking into what's causing all this pain. I appreciate your help.
Okay. So you've had a little chat with this AI bot, and you end your consult. What is your provisional diagnosis? So let's say ectopic pregnancy. Submit. And then you get given the answer. So the patient had a ruptured abdominal aortic aneurysm. But here is where the AI function really gets interesting. If you scroll down, it gives you specific feedback based on the questions you've asked. Hey there, it's great that you're engaging with the case. The patient actually presented with a ruptured abdominal aortic aneurysm, not ectopic pregnancy. To distinguish between the two conditions, it's crucial that you ask specific questions related to each. For an ectopic, you would inquire about missed periods, vaginal bleeding, pregnancy tests. In contrast, abdominal aortic aneurysm, key questions you ask are history of aneurysm, pulsatile abdominal mass, blah, blah, blah. So it gives you specific feedback based on the conversation that you've had with the artificial intelligence. Okay, so let me unshare that. Stop mirroring. Okay, so that kind of concludes the fishbowl and the patient interaction. Now, if you go back to the home page, so we've done the fishbowl, you've done the patient interaction. The third part of this app is the library and the back end. So here you can click on library, and when you go to this library function, this is what it actually comes up with. So you have a library of the emergency medicine program. You've got your 12 key cases. In this case, we were talking about abdominal pain. So you get the key learning objectives for this week, this shift, some written information about the different pain pathways, investigations on an X-ray, plicae circularis, some X-ray examples there, and the different key history, diagnostic problems. So ruptured AAA, got some management, some things there. So that is your library function. There's other things here, the MSAT practice. So when you click on this is what we can use in the guided learning session. So you have a patient and you do it in pairs. You click on this thing and it gives you the script to use for an MSAT, and it has a marking criteria checklist. And so one student has the computer and does the script, and the other student can't see the script and takes a history as normal. There's also a question bank. So let's say we want to do abdominal pain, we want to do the unattempted questions. Let's start the quiz there. And when you start the quiz, it gives you a whole lot of MCQs and short answer questions. Now this is the gamification part of the app. So you can see your learning, you've done this 34 out of 1,000 questions. Your classroom, this is your leaderboard. So you can compare your scores, the marks that you've gotten, with your other classmates. There's a session history that shows how many of the shifts that you've done and how far you're through. There's a summary of the learning outcomes again on this tab here. So that, I think, is the end of our little demo. Let's go back to the slides. So what are the next steps from here? Well, this demo we've created is just for one shift on abdominal pain, and that's already completed. Stage 2, we're going to create all the content for 12 shifts. So that's 86 case videos with MCQs and SAQs. That's going to take another 6 months, and we're going to go live in 2025. Stage 3, we want to make some money to self-fund the ongoing maintenance of this app. So in July, the plan next year is to have 2 versions. One app version is free for JC students and has all the lectures embedded. App 2 goes to the rest of the world, and that's like $50 a year subscription, but with none of the lecture material, just the cases and the AI function. Stage 4, we're going to expand it to have year 4, 5, and 6. So the acute care clinic in year 4, this could be supplemented by this app where you have, say, 30 cases from the acute care clinic in the same format. Year 5, there's the virtual GP clinic. So you could have GP cases rather than ED cases. And then year 6, you could have rural placement cases. And you just change the faceplate. Instead of the ED and the resus room, you can have like a rural clinic there. The next vision is to have this opened up to different colleges. ED trainees, GP trainees, and also the AMC might be interested. That is the end of this demo. Hope you guys enjoyed it, and looking forward to any feedback and questions you may have. Thanks very much. Catch you later.